I'm Dr. Johan, a consultant cardiologist at the Care Hospitals. And hypertension cannot be cured, but one of the ways of dealing with hypertension is, number one, is the diet. Now, Indians, we consume a lot of salt. An average Indian family would consume something like 8 to 10 grams per family member per day. In hypertension, the trick is to keep your salt content less than 6 grams. Anywhere between 4 to 6 grams is an ideal amount. And the way to do it is to avoid packaged foods, to decrease or stop eating pickles, and to consume as far as possible healthy homemade kitchen-based foods, which your wives or mothers are cooking. Now, the use of packaged foods or foods outside, especially junk food, which is available now in large quantities, the sodium content, which is the chief cause of hypertension, is extremely high. So we have to be very careful and make very good and careful dietary choices when we go out. The second reason for hypertension, or the second etiological cause for hypertension, is lack of exercise. So a sedentary lifestyle also contributes to high blood pressure. So it's very important for those of us who are extremely busy, who can't go to gyms and have a regular exercise pattern, to adopt healthy practices in our offices and homes. If we live in an apartment, we need to use the stairs while climbing up and climbing down. If you have an office where there's a lift, kindly use the steps. These are very simple ways by which you can exert energy without having to do anything specialized for it or even paying for it. If you're going shopping, it's good to park your car far away and then walk across. All these things expend energy and therefore prevent or control hypertension. The third important aspect is having regular checkups. It's generally recommended once you cross 40 for those without any risk factors, or for those who have a strong family history. A father having a heart attack or having hypertension before the age of 50, or a mother having hypertension or having heart attack before the age of 60. Those patients from the age of 35 itself need to have yearly screening. Now, most of the hospitals have fairly well chalked out master health checkups where your blood pressure is checked, your cholesterol is checked, your sugars are checked, etc., etc. So it's worthwhile for those patients to have these yearly checkups, and that will not prevent, but it will detect hypertension very early before the bad effects of hypertension are realized, and by simple medication, hypertension can be very easily and controlled in a very cost-effective manner.